How are you doing, Kevin?
I'm doing fantastic. How you doing, Dr. Hal?
I cannot complain. Life is good.
That's fantastic. That's good. I know you guys are staying very busy with game day, and there's so much stuff going on. It's so exciting. You've got 8 great locations all throughout South Florida now, and you guys just seem to keep growing and doing really good stuff. And it seems like you kind of tapped into a nerve with what you guys do.
Oh my God, it's been absolutely great. It's like being on a rocket ship. I mean,
Yeah.
just the 8 clinics down here in South Florida have just taken off, and then I think as of this morning, 370 plus clinics across North America. So we are officially the largest men's health network in the world.
Wow.
Yeah, absolutely incredible. I mean, to have that many brick and mortar locations, absolutely unheard of. And we've still got, like Evan Miller says, our founder and CEO, job not finished.
Yeah.
We're just getting started. So we're still I'd say about a third of the way there. We're probably going to develop all 1,000 locations. Once we're done with that, then we'll expand to the other continents, and it's going to be an incredible thing.
Tell me why you think it's taken off. What is making game day so successful? Because, in South Florida, there are a lot of places that do what you guys do, but nobody seems to be growing like you are. So
Yeah.
what's the difference?
So I think, when Evan asked me to take over as chief medical officer, one of the first things that we did was him and I got together and we hand selected a medical advisory board of approximately 18 board certified physicians and clinicians, all within the system, and vested interest, and just guys that are girls and guys that are all boarded, all academics, who really believe in what we're doing and want to do it the right way. And I think what happens is that patients are out there and they see the different options that are out there, whether it be the med spa spaces that are practicing out of scope, because a lot of those med spas have aesthetic practices or heavy aesthetic nurse practitioners and PAs, so they're not really up to date on the nuances of hormonal health. We have a stable of urologists and endocrinologists that we're in constant contact with, that we're bouncing ideas back and forth with, that we refer out to because we understand that we have a scope of practice, and we're good at what we do. We're good at men's health. And then anything outside of that, we would refer out. And I think patients are starting to see, when they go to these other places and then they come to us, the difference between somebody who specializes in a specific area, whether it be the hormone replacement therapy, erectile enhancement, performance, peptides, vitamins, musculoskeletal issues. They're really noticing the difference between us and what else is out there. There are some excellent other folks that are in this space. Usually they're urologists or endocrinologists, and we've partnered with quite a few of them, and it's been just an incredible ride. So I think that's what's happening. Is just that patients are just recognizing that.
Yeah, being a client myself, I can tell the things that you said and attest to that is when I walked in there, it just seemed like you guys really know your stuff, meaning that you've really dedicated to this. It seems very science backed. It seems like you can really delve right in, answer the questions easy and efficiently. I love the fact that you guys do the labs in house and that I'm not running up a $300 bill before I even get my first treatment. To me, that really meant a lot, because before, that's to me a really big barrier of entry. When you come in and it's $300 and you haven't even done anything to improve your problem. And I didn't like that feeling. And you guys are not doing that, which I really liked how you guys did the labs, and now you can do the same day treatment. You walk right in and get it done.
To be able to, because we're physician led and physician guided, we're able to have that complex lab within each one of the clinics. And that does take a pain point out for us guys, right? How much time do you have? You don't have much time to go in, get your labs drawn, then come back in and wait for those results. We have them right there in front of you within 15 minutes, and that's an absolute game changer for guys that in South Florida, the businessmen, executives that we're seeing, the folks that just don't have time to wait to feel better, really, right at the end of the day.
I've been to a couple other different clinics, and both of those clinics that I'd gone to before, I felt like I was more of a number, and they were just trying to give me the medicine and get me out the door. And with game day, coming back and having continual checking of my labs to see exactly where my levels are, and have somebody that's really asking me a lot of questions and is really kind of grilling me about where my levels are and what's going on with my diet and everything else. I notice a big difference in how I feel. And I just feel like I'm with somebody that is a lot better. And this may be a minor thing, and maybe it's only at the clinic I'm at, but the guy that I'm dealing with is so great at drawing blood. And let me tell you, that is such a massive deal, because I have been butchered before. I've walked out with bruised arms, and it just looked like I got attacked by a tiger. And I go in there, and everything is so professional through and through. And that's why, to me, I'm so sold on game day.
I'm gonna tell you a little secret about the blood draws and why we're so good at it. Every single franchise administrator within the entire system asks our medical assistants to actually draw blood on us, so that they come in, they get their training and everything else, and they come in educated, and then they get game day training. But then we make sure that the treatment, what we feel is what the patient's going to feel, and we've let go of quite a few people before they even get hired when if they don't meet our criteria. We're pretty exacting on those standards. So that's in a concierge practice, you want to be able to differentiate, and that's one of those things. You don't want to feel pain. You don't want to have that bruising and all that. So we're very careful about that.
Honestly, top to bottom, everything about it's just top notch. So I can see why you guys are taking off like a rocket ship, and I'm not really surprised. Now, the conversation that we're going to have today, it's really kind of an awkward thing for me. I think probably for a lot of guys, talking about erectile dysfunction. I don't know how other people feel about it. To me, I think, one, it's weird talking as a guy openly about your sex life, and not only that, but just a dysfunction about your sex life.
Sure.
Because when you're talking to your buddies, you never would talk about dysfunction that you have with your sex life. You're only talking about how awesome you are and how solid you are. And I've grown up with that mindset. So to have this conversation, to me, is tough. And I'm wondering, do other people feel the way I do? Is this a tough conversation to have with patients? Do you think there are a lot of guys out there that are suffering from erectile dysfunction that, because of vanity and pride, that they're not coming forward and saying something about it, or having a hard time having a conversation about their problem?
Yeah, absolutely. I mean, there's still, guys our age, we don't talk about our feelings, right? We don't talk about those things that are so deeply can affect not just your sex life, but it can affect confidence levels, right? So your confidence levels, because of that, and then that's going to affect your work life, your love life, maybe how you behave with your children, with your friends. All of those things are directly correlated, and it's not easy to talk about. The idea that it's not everyone's going to go through it is just completely out the window. I would say the grand majority of guys are going to deal with erectile dysfunction at some point in their lives. More than 50% of guys over 50, younger than 30, 40 years old, a quarter of the guys are already dealing with it, and it's due to a multitude of different issues. And that's something that we're seeing within our patients. They don't enjoy, obviously, talking about their issues, but once we do get them in the consult room, and they understand that they're speaking to a medical professional and we're here to help them, they do open up. And we do see a lot of guys that come in that don't mention that on the onset. They come in because they just sort of want to see what their levels are at, and then once they're in the consult room, that's one of the first questions I'll ask them, because erectile dysfunction, 30% of the time, it may be hormonally related. So there's, let's go to the physiology of an erection, and I'm going to do a quick anatomy and physiology refresher. Okay?
Welcome back to 8th grade, Kev.
So it's a neurovascular event, right? That's what an erection is at the end of the day. You've got sexual arousal, right? Or you can have, it'll be either up here or down there, right? It gets activated. You have nitric oxide production. It'll be released from like your endothelial cells, your nerve endings. That activates cyclic GMP, which is what causes smooth muscle to relax in the penis. And that's where you get blood flow. So it relaxes, you get blood flow increase, you'll have a venous outflow sort of restriction, and that's where the blood stays in the penis. Now, interruption at any point is going to impair this process. That's where you get that erectile dysfunction. So how do you impair that? It's going to be neurological, vascular, hormonal, or psychosomatic. So those are the four main causes, right? The most common causes. What I see in my practice, in our clinics, the vast majority of folks are going to have vascular issues, so blood flow issues, and the erectile dysfunction is actually one of the harbingers of cardiovascular issues, because the arteries in your penis are a lot smaller. So if those get clogged up first before this gets clogged up. So one of the first things I'll tell guys that come in with erectile dysfunction that we know there's not, just a hormonal cause, that we know that we figured out that there's a vascular cause, is we'll tell them, you got to diet and exercise. I need you on a sort of a strict diet exercise plan, and then we can work on the different things that we can do in the clinic to help you with it.
How do you even know that you have erectile dysfunction? Because I think most guys might have an issue from time to time. You're on vacation, you've had a couple drinks, it's just not working right, and you're like, okay, is this a one-off, or how consistent does it have to be before you could even say that you would be a clinical case of erectile dysfunction?
I'm of the school of thought that at 18, 20 years old, everything works great, right? And then you start to see a decline because you're going to start to build up plaque in the penis, so you're going to have decreased blood flow in that area. Your libido starts to decrease also as you get older. So there is some level of dysfunction or lack of performance, because as you get older, things start to break down a little bit more. And everyone may benefit from the different natural solutions that we have. So we're big on not jumping straight to pills, because that's something that when you go to some of these online places, you type in what your symptoms, and all of a sudden you get a box and you get a pill. And that's how they're treating it. We go more, let's use natural, effects, natural solutions for it, whether it's the P shot, which is PRP, platelet-rich plasma, or low-intensity acoustic sound wave technology that we use in the clinic to sort of break up those plaques, increase more, blood flow to the area, bring vascular endothelial growth factors to the area. Those all are more of using your own body's regenerative function to bring back erectile performance, really. Mm-hmm. And then you can always add on the pills as well. Some of the lower dose of Cialis or tadalafil is actually being used as a longevity medication, because it helps open up the blood passageways everywhere, and that it helps up here, and down there.
What does that PRP process look like? How do you treat it? How long does it take? And is there any discomfort that goes along with these treatments that you're talking about?
Okay, yeah, we get that question a lot, because people say, oh, wait, you're going to inject where? We draw your blood, right? We're going to get your blood. So it's your platelet-rich plasma. We draw your blood, put it in a centrifuge. We'll spin that, and we'll get that, the liquid gold, that platelet-rich plasma, and sort of inject that back into the penis. Doesn't hurt. We use a numbing cream. It can take up to 6 months to see the total effects of it, and we do recommend maintenance dosing as well. I like to combine that with shockwave therapy, low intensity sound wave technology that we've got in the clinic. That combined with PRP, and sometimes you may need a little bit of an addition of a daily tadalafil or as needed tadalafil with it. We also offer a penis pump that will help sort of bring blood flow to the area as well. And the combination of those, we've seen guys who've got mild to moderate erectile dysfunction really improve. About 75% of them improve to a point where they're pretty happy with the results.
Okay, so walk me through things that you could do if you're listening right now and you understand that you're having some issues, and you're saying, okay, you said something about the diet and the health part. If somebody were proactive right now, and my curiosity, because I'm doing the hormone replacement therapy, and I have noticed a difference in my sex drive and performance and everything else. And to me, that's fantastic. And I love that. And I'm wondering how many other guys could avoid having to come in for erectile dysfunction treatments if they did the diet, the exercise, got their mind right, and then just did hormone replacement therapy. Do you find that that can be a good first step to try that before you have to go into the PRP and the shockwave treatments?
It depends. It depends, right? So the common causes is like, four really main causes is the vascular that we spoke about, right? That's the most common, which will be, you can fix that with the shockwave therapy with PRP. because that's the same. It's the same disease process that causes heart attacks, right? It's blockages in your heart, blockages in your penis, same sort of pathological physiology, right? Pathophysiology, sorry. And then you've got, along with that, hypertension, hyperlipidemia, endothelial dysfunction, all that goes into the vascular causes, which is the most common. Then you've got the hormonal causes, which is maybe anywhere from 15 to 30%, which is low testosterone, hypogonadism. A guy like how you and I were before. We came in with low testosterone symptoms and hypogonadism, which is the testosterone deficiency, right? Sometimes you can have diabetes, thyroid dysfunction in rarer causes that can cause erectile dysfunction. Then you've got neurological, which is pretty rare. It's something that you're either born with or you've had a trauma, whether it's a spinal cord injury, a congenital disease that you were born with. Some guys, due to medications, SSRIs, depression medications can cause it. Beta blockers, some diuretics, some finasteride can cause it, which
okay.
It's one of those drugs that it's not great.
Wow. Tell me what you think about finasteride. If guys don't know, that is something that other people will be taking for hair loss. You got finasteride, you got dutasteride. So
Sure.
Talk to those and the contributions they have towards erectile dysfunction.
Yeah. So, if you're using them topically, or if you're using them as low dose, usually they're not going to have erectile dysfunction issues, but at higher doses that can definitely contribute. It's also, like we were talking about, the lifestyle factors, smoking, alcohol use, obesity. Obesity is actually the number one cause of low testosterone, and low testosterone is one of the causes of erectile dysfunction. And obesity is one of those things that if you get into that vicious cycle, obesity causes low testosterone, and then a low testosterone state causes you to gain more fat, which can cause more weight gain, especially the abdominal weight gain, and then you're sort of stuck in this vicious circle. So sometimes hormone replacement therapy may be a good initial choice, but a lot of guys that come in, I know they've got vascular erectile dysfunction, and I know we can help them, because this is one of those things that you don't want to wait for it. If you're feeling erectile dysfunction issues, if you're not waking up with morning erections, you're having a decreased libido, there's all of those things that go along with erectile dysfunction. We have the solutions for it, and we're able to treat it naturally. You don't have to wait for it. It's not going to just be a pill, and it's going to be in person. It's in clinic. You're going to see the same clinician. You develop a relationship with them. I did also want to sort of take this chance to let you know that we are providing telehealth services now across South Florida, across actually the state of Florida, and I think we've got about 40 clinics. And the cool part about it is we looked at, the executive team looked at how telehealth is performed across the country. And what happens is, you'll punch in some information and maybe you'll get a call back from a provider. You'll never see that same provider again. There's no follow-up. And if you do see a provider, it's not going to be that same provider. They're going to rush you off the phone because those providers are generally paid per visit. The difference in what we decided to do was that you are going to have a brick and mortar location available to you. And it'll be near your house, because we've got almost 400 of them that are, open across North America. You will see the same provider. And that, continuity of care is one of the most important things. Mistakes happen when you don't see the same clinician because they don't know your history. Maybe they have, there's something that you mentioned to a provider that they didn't put down in a note, or let the other provider that you're going to see know. You won't have that with Game Day. You're going to see the same provider. You're going to have that brick and mortar location. You always have the option of going in, getting your blood work in the clinic rather than just doing it at home, getting those vital signs done. All those things that are super important when it comes to erectile dysfunction, hormonal health, that is safer having that brick and mortar location nearby. And we're pretty excited about that. We just sort of launched it this year, and you're going to start seeing more of our presence in the telehealth space. And I don't want to take anything away from those guys. Who are they? The she's and he's, or whatever they're called.
Right.
We're trying to do things a little bit more safe and
Yeah,
patient focused. rather than just ship you out the medication that you chose by a couple of clicks.
My question about medication, because there's stuff everywhere. I was in a gas station in South Florida the other day, and there's a product called Chubby Beaver, and it's a beaver with a large erection in his pants. And I'm thinking, I'm sure there are guys that are coming in there on a Friday night, and they're like, all right, this is going to be it. I have no idea what's in Chubby Beaver, but, it just shows the desperation, and people are looking for a cheap, easy fix. So what are people seeing with these medications? And ultimately, my question, the traditional standard has been around for a while, is the blue pills, or like you had mentioned, the she's, the Hims, whatever we call that thing today. What is the difference with what you guys are doing to somebody who's saying, you know what, this sounds like a lot. I'm just going to get a pill and that's going to be better. It accomplishes what I need. Why would I even need game day?
Yeah, because that's going to mask, right? That's going to mask the underlying issue. There may be a lifestyle modification that has to happen. The discussion that you're going to have with a game day clinician, all of our clinicians are board certified, by the way. The lifestyle modification, whether it's quitting smoking, limiting alcohol, losing weight, exercise, the follow up, the lab work that you're going to get on a regular basis, and then the natural solutions that we've got versus just here's a pill and you're on your way. For me, a person that comes in with erectile dysfunction needs to be closely monitored, because that it's like a canary in the coal mine. It may be what the early onset of heart disease is.
Wow.
And this may be someone that I want to get my cardiology buddies to take a quick look or refer out to, and that's to keep patients safe, right? At the end of the day, that's what we went into medicine for, is to do the right thing by the patient, not turn it into something transactional.
So a bigger issue than just getting an erection is coming in to make sure that you are not sitting on a ticking time bomb that's going to do worse than just not being able to have sex.
Yeah. Now, and how do you differentiate whether it's a hormonal issue? Like you said, what if it's just, you need some testosterone, or if it is a vascular issue? You can't have that on, online. You've got to come in.
Speak to me about the treatments, because I am very nervous about pharmaceuticals.
Mm-hmm.
And when you talk about those pills and the Pfizers and these companies, when they get involved, that makes me nervous. Should I be nervous? And talk to your natural remedies versus going with a pharmaceutical blue pill.
So sildenafil, was it Viagra, tadalafil, Cialis? They've been around forever. You're right. They're initially I think they were approved for something else, and then they realized that it worked for erectile dysfunction, and it helps. It triggers nitric oxide release, and it can inhibit what degrades that cyclic GMP that we were talking about, which relaxes the smooth muscle and allows for increased blood flow. So they work really well. Within 30 to 60 minutes of taking the medication, peaks in a couple of hours, and then it'll go away in about 4 to 6 hours. So it's not a terrible medication, but I'm not a huge fan of let's throw a pill on it if I know I can fix it naturally versus adding another medication. Now, medications are also not without side effects, whether they're hepatic renal impairment, liver, kidney issues. Guys that have heart disease to begin with, maybe that's not someone that you necessarily want on these medications. It can sometimes cause, low blood pressure issues. You may have priapism, which is an erection that lasts longer than 4 hours that you can turn into a medical emergency. Some rare folks can have like a hearing loss or tinnitus. If you have a history of like heart disease and you're on nitroglycerin, nitrites, or you have severe cardiovascular disease, unstable angina, that heart pain, the chest pain, a recent heart attack, uncontrolled, hypo or hypertension, those are contraindications to these medications. Are you having those discussions with, an online provider? Probably not. And that's something that is to keep patients safe. We go through all of that. So we'll go through like the patient counseling before you'll start with it. And then, the other option, tadalafil, is a newer one. I like it better as, with the lower dose, it seems to work really well with a lot of patients. But I'm really partial to low intensity sound waves and the PRP. That has had 75% of our patients report excellent results with that. and they're pretty happy. Their wives are really happy. You know, their girlfriends are really happy. So,
well, that's good. Now I know with
so.
Now I know with the hormone replacement therapy, about 2 weeks in, I started noticing, okay, I'm feeling different. By 3 weeks, it was obvious that it was the hormone replacement therapy that was really doing a difference and changing my life in a positive way. When you come in for erectile dysfunction, do you have a standard timetable? And what does that timetable look like, what you start looking for? Because if somebody walks in and they can't get an erection at all, how long are you talking about that person being able to be sexually functional from the treatments typically?
If this is a patient who is still getting morning erections, or at least some, you know, is able to get some sort of erection, they'll do really well on these. If they're not getting any erections, if you know, if they're not getting any erections, even using medications, the you know, the blue pill.
Wow, that happens, huh?
That does happen. It does happen. And then we've got, you know, other options. Trimix, which is a medication. It's an injectable that you inject right before sex, and that it's not as comfortable as some of the, you know, the other erectile dysfunction treatments, but that's sort of like a last ditch Hail Mary approach. But we do have guys that are older that are still very sexually active and want to be able to perform, and that's an option for them.
Walk me through what the day looks like getting into game day. I go onto the website, I book an appointment, and then I just come into the clinic and I'm meeting with somebody face to face. And how long before I start getting treatments, and how much examination do I need to go through? What does that process typically look like?
Sure. When you first walk in, you know, you're going to be greeted by our front desk, and, you know, offered a snack or a drink while you fill out your intake paperwork if you haven't yet. If you're coming in for testosterone replacement therapy or, you know, some of our other options, you may get some lab work almost immediately, and then you'll meet with our clinic director. We'll get some. Well, before that as well, we'll do a physical. We'll get, you know, some vital signs, and then a short history, and then a more detailed history with our clinical director. And then we can make a decision on what we can help with. You may walk out with your treatment plan in hand. You may actually get your first treatment that same day. And that's something that, you know, we're pretty proud of as well. If it's for erectile dysfunction, and you qualify for the low intensity shockwave technology or the PRP, you can actually get a treatment that same day. And we recommend anywhere from 6 to 12 treatments of the shockwave therapy, plus, you know, 1 or 2 PRP therapies as well. And that can be a treatment plan that could be 6 weeks to 12 weeks before you see the full effect of it. You may add on, like I said, the pills with a penis pump as well, to sort of just optimize all of the treatments that are going in with it.
So what does it look like for me going forward? Is it only 6 to 12 weeks and I'm done for good? Or is this something where I need to keep coming in? Is this continual treatment?
Yeah, that's a good question. And I get that question a lot from some of my patients. It's, and not to dumb it down too much, but I look at it as like, if you had a plumber come in and unclog your pipes, there is a chance that, you know, in 6 months to a year that those pipes become clogged again, and you may need some maintenance work. And we have seen that, not all the time, but we have seen patients that do need to come back in for a touch-up or another, you know, maybe not just as long a course, but you know, a shorter course, maybe 3 shockwave and 1 P shot. There are patients that do really well on this, and get you know, their hormones optimized, they get their lipid panels optimized, they, you know, get their blood pressures regulated. They're in the gym, they've got their diet really dialed in, and those guys, they do really, really well after. So that may be your case, and I think it probably would be.
How much is my consultation going to cost me?
It's always complimentary, you know that.
Okay, just want to make sure. That's great. GameDayMen'sHealth.com is where you go. Dr. Howe, thank you so much for so much great information today.
Thank you, Kev. Take care.